thought maybe we would talk about what music therapy is not. So often when I tell people that I am studying music therapy, they're like, oh, that's so great. Like when I'm having a bad day, I listen to such and such and it makes me feel so good, And I say, yeah, that's great, but that's not really music therapy. So I think often there are a lot of misconceptions because the word therapy could mean just making somebody feel better, right? But music therapy does a little bit more than that. So first I thought we would just make sure that we know what music therapy is not. So music therapy is not simply teaching clients to play musical instruments. It might look like that sometimes because we do play a lot of musical instruments in our sessions, but actually we're being really sneaky and working on a whole bunch of goals and objectives, which we'll talk about later. So it's much more than just playing musical instruments. Also, we are not simply just playing music for our clients. There's much more that's happening, although once again, it might just look like that in our sessions. So, like I talked about, the word therapy gets kind of tricky. So music can be therapeutic, and there are ways of listening to music as therapy, but it's not music therapy. So examples of this therapeutic music might be an individual in a nursing home who maybe has Alzheimer's, listening to their favorite music from 40 years ago. Maybe some of you have seen, there's a really popular video on YouTube of an elderly gentleman who has really just kind of shut down and is nonverbal and not communicating in any way, and then they give him an iPod and he's listening to music from like 50 years ago or something like that, I think, and his eyes get real big, he lights up, he starts to sing along, and he's tapping his foot and dancing, and so he's having all of these really great responses to music, but it's still not technically music therapy. Another example of therapeutic music would just be maybe nurses playing background music for their patients, making them feel better, or even just a piano player in a hospital lobby or a nursing home, there are a lot of music volunteers that go and play music for people, which is wonderful, not necessarily music therapy. Also arts educators, that could be just like music educators in schools. Perhaps that would definitely be they teach clients how to play musical instruments. It's not music therapy. So, what is music therapy? Music therapy is an evidence-based healthcare profession. It targets clients' goals and objectives, and often when we're talking to people about music therapy, this is at least what I tend to stress to them, the non-musical goals, which simply means that we target these domain areas. So yes, we're playing music for them. Yes, maybe they're playing music with us, but we're working on social and emotional goals, motor or physical goals, communication, academic, sensory, a lot. So examples of clinical music therapy with a credentialed music therapist would include working with Congresswoman Gabby Giffords to regain her speech. This is something that was really great for the music therapy profession that happened in like 2009, I think, and it just made music therapy a big topic because I think they had like an ABC special or something about her. So if you didn't hear, Congresswoman Giffords, I think in Arizona in 2009, was shot in the head, and she lost her speech. But through her rehabilitation in the hospital, she was able to work with a music therapist and regain her speech through song. Also, we work with children with autism to improve social and communication skills. We could also work with hospitalized patients to reduce pain. And premature infants to improve sleep patterns and or increase weight gain. So there are many populations that music therapy can serve and help, and those include children and adults with intellectual disabilities, developmental disabilities, behavioral or emotional disorders, anybody going through neurologic rehabilitation, hospice or palliative care, sensory disorders, or geriatric populations. So I like to think that music therapy can help everybody, but there are definitely many populations that benefit from music therapy. So two different types of music therapy settings. One that happens here at Cornerstone is a group setting, But maybe most often, at least with dynamic music therapy, we have a one-to-one setting, which is an individual setting for music therapy. So there are definitely benefits to each. A benefit for the individual setting is definitely the one-to-one attention. You perhaps could get more out of the session just by having that personal attention for a longer period of time. Also, some of our clients require hand-over-hand assistance, and that's something that, unless you maybe have a lot of aids throughout a group session, is difficult to do and facilitate in a group setting, so that is definitely a benefit of an individual music therapy setting. And also, I kind of mentioned before, it's just maybe a little bit easier or more beneficial for the client to work on more specific or individualized goals in that individual setting. However, groups are really great for peer socialization. You can also work on sharing, following directions, and work on peer relationships as well. And also communication skills within the group. So it definitely, I think it would be up to the music therapist's discretion as to whether or not the client would best be suited for an individual or a group setting. I think a combination of both is perhaps the best way to go for some clients, because groups are really fun. So a music therapy session structure. This is typically what happens during a music therapy session, and as we started our session today, we sang hello. So that's typically what we do in music therapy, and that's kind of just a way to make everybody, especially if we're in a group setting, we all know each other's names now, and we kind of are feeling more comfortable and familiar with this space. And if this is something that we do on a weekly basis, that is the expectation, and that helps the clients know that, okay, it's time for music therapy, and this is what we do to start every session. So it's not always appropriate because we do work with clients who are higher functioning and adults or even geriatric patients. I'm not going to sing that hello song with them. Maybe even it would be like funny or fun to do at one time, but it wouldn't be working on the same goals that I'm trying to achieve with that particular hello song. So after the hello song then, we come up with a variety of what we tend to label as music therapy interventions. So this is where we come up with whatever goals and objectives we are deciding to target and create our interventions to target those specific goals. So once again, that could be something having to do with movement or academic skills, social, communication, gross and fine motor, all of the above. Typically, the interventions might last 5 minutes or so, so we have a total of 5 or 6 throughout the session. Jennifer might be able to talk about this more later afterward, but a really great thing in Indiana is the Medicaid waiver, thanks. I always do that, the Medicaid waiver. And so typically we have 45-minute sessions with that. And so also for those older or higher functioning clients, they might not really benefit from this type of session structure. So instead, they might participate in song lyric analysis or songwriting or even music and exercise or music and relaxation. Those are all music therapy techniques, and those are great things to work on, especially with older or higher functioning clients. And then if it's a typical session with our 5 or 6 interventions, we're going to end with a goodbye song, just like the hello song, to let everybody know that we're done with our session and saying goodbye to everyone who participated in our group. So just like it's important, at least to me, to distinguish between what music therapy is and what music therapy is not, it's also really important to know who is a music therapist and who is not. So, like I said, there are probably lots of people who volunteer their time as musicians and go and play in hospitals or nursing homes, and that is a really wonderful thing. But they're not music therapists. Maybe they are, because I do that too. But typically they're not. Instead, a music therapist is anyone who received a bachelor's degree or higher from an AMTA-approved institution. Now, AMTA is the national organization. It's the American Music Therapy Association. And like I mentioned before, this includes typically a 6-month internship after their coursework. So that is in all totaling 1,200 hours of clinical training before they're ready to sit for the boards, which will enable them to be an MTBC, which is Music Therapist Board Certified, and that is credentialed through the Certification Board of Music Therapists. In addition, some states are requiring additional licensure for board certified music therapists. And it's just important to note that music therapy, although it has music in the title, and that's a huge component, we also study a lot in psychology and medicine. So there's just a lot that really goes into music therapy and being a credentialed music therapist. So what do music therapists do? We accept referrals, and we observe clients' behavior and assess the domain areas, which I've mentioned a lot now, but once again, that's social, emotional, motor, physical, communication, academic, sensory. So that's the very first step. When we first meet a client, we don't necessarily know anything about them, or we haven't worked with them before, and so we take maybe 5 or 6 assessment sessions where we just do a various amount of things to test their social and emotional functioning, motor and physical, etc. And that also is a great way to build rapport with them. We can just see, what they're into and what works well with them. So that's the first step. And then after we have assessed all of these domain areas, we're able to come up with a treatment plan. And then we come up with our treatment plan to address the identified needs that we get through the assessment. So then we're able to incorporate strategies, procedures, and these interventions that we come up with to develop the skills necessary to achieve optimal levels of success and or quality of life. Along with this then, once we've formulated our treatment plan, we take data. A really big thing, especially with the Medicaid waiver, is just documenting clients' progress. Sometimes that's difficult to do in music therapy. Sometimes we have to really, I don't know what the word I'm looking for is, just be conscious about coming up with the data. In that, it's not always easy to document the responses that you see in music therapy. But we manipulate it, I think that's the word that I'm looking for, so that we can have qualitative data to document. And so that's helpful when evaluating the progress, performance, and then also we can make recommendations for further treatment for our clients. So in addition to that, then, the music therapists often work with team members and families. That's really, I think, really important for the client's overall success if all of those different disciplines can work together. So often with the med waiver, which is what we work a lot with, there's a case manager for the client, and then if they're receiving any other services, we meet every 3 months or so and discuss the client's progress and what they're doing in your individual discipline, and then maybe you can talk strategies for how to help overall and support success in other aspects of the client's life. So specifically, music therapy and autism spectrum disorder. Research is really important. Like I mentioned before, sometimes it's difficult to really define the type of responses that happen in music. But actually, I think the most music therapy research literature exists about autism. And so the literature shows that clients with autism spectrum disorder have a positive response to music. Music provides an intentional and developmentally appropriate experience. It affects changes in behavior, and it facilitates development of skills. Music is a basic response spanning all abilities and disabilities. Everyone can be successful in music therapy. Music therapists meet clients at their own level, and then they develop their skills after that. So once we go through our assessment process and we come up with our treatment plan, we're not going to expect the client to do something that they're not at that moment going to be able to do. And so therefore, we're going to meet them where